emergency room is the last place anyone wants to be, especially for hours.
When I got there, quite a bit of people in there, so I kind of expected 2-hour wait at the top.
Patricia Carlton says she went to Mobile Infirmary's ER 2 months ago with severe abdominal pain.
2 hours rolled by. I'm sitting to my fiance, go ask them how long it's gonna be. 3rd hour roll around, still nothing. 4th hour roll around, so by now, I'm about to pass out. Can y'all get somebody out here? And you know, they told, well, everybody out there is sick.
Carlton's paperwork shows she was in the ER for 5.5 hours. She says she saw a nurse practitioner for standard lab work and an ultrasound just to be sent back out to the waiting room each time. She decided to leave, still not knowing what was causing the pain. And she got a bill for $1,400.
Why wait? We done spent the whole day here. Ambulance keep pulling up, and I know the more they pull up, the more I'm gonna be pushed to the back. And my words to her was, take me home. I'd rather die at home because I couldn't get the help.
A few days later, with a high fever, she went to USA Children's and Women's. And from there, she doesn't remember.
The next time I came alert, I was in ICU. I was on breathing tubes. I had IVs in my neck. Like, I remember nothing.
Doctors told Carlton her appendix had ruptured. And the pus and bacteria from inside her appendix was leaking into her bloodstream for days. She needed it removed immediately.
And I feel like I should have never made it to that point. I feel like this could have been stopped before I even went to hospital after hospital.
Infirmary Health Systems would not specifically comment on Carlton's case. It did issue a statement, though, which reads in part, Mobile Infirmary is committed to providing quality emergency care for the communities we serve. A registered nurse and a provider met with the patient at the point of entry to assist with the initiation of the medical screening exam. We wanted to find out if Carlton's story was a worst-case scenario, so we studied the ProPublica numbers. The organization gets its data from the Centers for Medicare and Medicaid Services. The most recent data released by CMS was recorded from April 2015 to March 2016, and in fact, Mobile Infirmary has the lowest average wait time in Mobile County at just 15 minutes. ProPublica compares each hospital to others of the same size nationwide. In Mobile County, the national average ranges from 23 minutes to 27 minutes. Mobile Infirmary below those numbers, while Spring Hill and USA Medical Center are above. And according to ProPublica, USA Medical Center is more than twice the national average, with patients waiting more than an hour to see a doctor. The data also suggests USA Medical Center on average has the longest wait time in the state.
It just doesn't take much to overwhelm the system.
Dr. Edward Panachek is the director of USA Medical Center's emergency department. He says while ProPublica may compare hospitals to others of the same size, he says it doesn't take into account that USA Medical Center has the only level 1 trauma center in our area, meaning the Gulf Coast's most serious injuries come right here, and those injuries are always treated first.
It's not that I don't agree with the ProPublica numbers. I'm just saying that, number one, they're old numbers, and so they don't reflect the current situation.
Dr. Panachek also says the hospital is addressing the problem, and they've hired more people to help drop those wait times.
And our numbers right now for the last 6 months or so, for the time from hitting the door to seeing an independent practitioner has been under 38 minutes.
But still, officials from every hospital we spoke with say the wait times can't always be predicted. One problem, many people crowd the ER for non-emergencies because it's the only way they can see a doctor without insurance. Healthcare professionals tell us it's a growing trend. At Spring Hill Medical Center, for example, there's been an increase of more than 15,000 people coming to the ER in the last 3 years alone.
We do really well on seeing the doctor. We do really well on treatment to discharge. We are not as good at treatment to admit, again, because the hospital's so full.
Spring Hill Medical Center President Jeff St. Clair says also contributing to the waiting game at many hospitals, a growing patient population and not enough beds, meaning some patients in the ER can't free up their space for the next person until a bed in the hospital becomes available, adding even more wait time for those left in the waiting room.
It's a good thing for the hospital, but it's not so good if you're the one waiting for the bed.
But we're looking at ways of expanding, building more beds. The demand is there. I mean, we really only have about 150 functional beds, and we had 171 patients in the hospital just a couple of days ago. So those patients, we didn't even have beds for them. So they were boarding in the emergency department and boarding in our post-anesthesia care unit after surgery, waiting for beds to open up. The place was just packed to the gills.
It's a problem that many hospitals on the Gulf Coast say they are working on, but without the right funding, it is an uphill battle.
If it had been caught in the beginning, from what the doctors told me, I wouldn't be in this stage.
Carlton says she just hopes something else can be done so that others don't fall through the cracks of the waiting game. And many local hospitals are doing a few different things like small expansions to try and alleviate the waiting times. We'll have more on that on our website, fox10tv.com.